Faith United Methodist Church. My name is John Shugart. I have the privilege of serving here as one of the pastors. I'm really excited about our event this evening, excited to welcome people from the community, people who care about the residents here in our community and in our state. Part of our mission here at the church is to love our neighbors, and in order to do that well, we have to be aware of all of the different issues and policies and things that affect how our neighbors live and if they're able to live a full and healthy life. And so, welcome to all of you. I will just say this is not a faith-based town hall. This is also not a partisan town hall. This is an informational town hall. And I hope that all of us will approach it with curiosity and empathy and respect for one another as we hear from our panelists this evening. Also, I'll just let you know there are bathrooms just out those double doors in the main hall. Probably the most vital piece of information. So I am going to turn it over to Sadif, and she's going to begin our program this evening.
Thank you. Sorry about that. I got my whole agenda backwards. So thank you for hosting us today. I want to give a shout out to Pastor Emily and John. Thank you so much. Sorry. Especially on such short notice. Really appreciate you both and this community for us being here tonight. So thank you to those of you who are here, who battled the traffic and got here this evening and taking time on a weekday to be with us to talk about these important issues. And I'm sure you're here because you're hearing about all of the actions and decisions being taken in Washington, D.C. and are concerned about their impacts on you, on your neighbors, your family, your community, and on all of us. Tonight we're going to focus on a couple of those issues in the federal budget. Discussions that are happening right now, cuts to Medicaid and to SNAP, the Supplemental Nutrition Assistance Program. And if they come to pass, they will have wide, sweeping, and deep impacts across Florida and, of course, across the nation. But we're here tonight to talk about what that looks like here in Florida. So before I dig into some of that, I wanted to take a moment and introduce FPI, Florida Policy Institute. So if we could go to the next slide, please. FPI is a nonpartisan, nonprofit organization, and our mission is to advance state budgets and policies that expand economic opportunity, that improve the quality of life for all Floridians. Our vision is a state where all Floridians have an equal opportunity to thrive, where everyone has access to healthcare, housing, education, good jobs, regardless of who you are, where you're born, where you come from, without any barriers due to race, ethnicity, gender, sexual orientation, sexual identity, or anything else. Next slide, please. So we do this by publishing research and analysis on the pressing challenges that Floridians are facing every day, and also highlighting opportunities where we can further economic opportunity. We cover a range of issues from education, health, immigration, worker justice, criminal justice, and a host of other tax and budget policy as well, and more. We analyze public policies and we develop solutions to address the challenges that we're facing. We work to educate policymakers, the media, all of you, all of us, everyday Floridians on these issues and to cut through some of the noise that's out there. And we work together with our partner organizations and in coalition to advance, shared priorities and goals, and then we advocate to see some of these common sense solutions come to pass that expand economic opportunity. Next slide, please. So our agenda quickly for tonight is that I'll provide a brief overview of what the issues are that we're facing. We'll have a quick discussion with Kim Johnson, who is the president and CEO of Florida Impact, and Scott Darius, the executive director of Florida Voices for Health. We'll have some time for a Q&A, and then we'll wrap it up so everyone can get back to your evenings. Next slide. So just very briefly to provide some context on what exactly is happening right now at the federal level. Congress is currently working on developing the next federal budget. The House Budget Committee released a budget resolution, and this is basically a blueprint that provides guidelines for what ultimately will become the federal budget. Various committees will take this blueprint and they will go back and develop recommendations within their areas that they're responsible for, and eventually it will become the federal budget. The Senate also has a budget resolution. However, it's really at this point the House version that is really driving the conversation and their vision that's kind of leading the way. And the proposal that's been advanced, it calls for deep cuts across several programs to the tune of $1.5 trillion. This includes critical programs like Medicaid and SNAP, but also free and reduced school meals, and the tax credits that people get to afford health coverage in the Affordable Care Act marketplace. At the same time, the proposals are also calling for expanding tax breaks for the wealthiest 1% of the population. And coincidentally, the cost of those tax breaks is about $1 trillion also. So almost a one-for-one match with the cost of the tax cuts. The funding cuts for critical programs. And there's no question that these cuts are going to have really, really deep, devastating impacts for families and children and communities across Florida who rely on these programs to afford health care, to put food on the table, and just get by day to day, especially as we're seeing the rising cost of living in almost every aspect of our daily lives. But I also want to emphasize that these cuts will not just impact people who benefit from these programs, who receive these benefits. This magnitude of disinvestment and this magnitude of deep, deep cuts will impact each and every one of us as their consequences ripple out throughout our communities and throughout our economy. All right. So just to give you a sense of what really is at stake, there are, when it comes to Medicaid, and this is from a tool that's on our website, it's floridapolicy.org. It's an interactive map where you can search how many people benefit from various programs county by county. So check it out if you're interested. But just to give an idea of this particular area that we're in tonight, you can see up here some of those recipients of Medicaid and SNAP. But across Florida, there are 4 million people who rely on Medicaid to access health care. So that's about 1 in 5 people. Most of us will know somebody who's on Medicaid to access health care. And the proposals that I just described call for $900 billion in cuts to Medicaid by basically arbitrarily limiting how much funding there can be per Medicaid recipient, regardless of how much it costs to run the program. In regard to SNAP, the proposals call for $316 billion in cuts over 10 years. And there are over 3 million people in Florida who rely on SNAP. So to give you a sense of the deep impacts that this would have on families, like I said, who are really just struggling to make ends meet to begin with, and then seeing this level of scaling back and taking away benefits that are really keeping people afloat at the moment. Just in this area, you can see there will be hundreds of thousands of people who will be potentially without access to health care or nutrition benefits, which we should all be concerned about, even if you are not participating in any of these programs. So with that, I want to start really digging into the conversation with Kim and Scott. So first, if you could each take a moment and just introduce yourselves and your organizations and what you do.
Good afternoon. My name is Kim Johnson, and I am the President and CEO of Florida Impact. We are a 45-year-old anti-hunger organization. And what we do is we mobilize communities to access all the federal nutrition programs, especially those families and individuals that live in under-resourced communities. And we usually do that 3 ways: through community engagement, through advocacy, and then food access. That good?
That's great. Thank you.
Hi everyone. Good night. My name is Scott Darius, Executive Director of Florida Voices for Health. We're a statewide health advocacy organization, and our mission is to increase access to healthcare for low-income and middle-income Floridians. But one thing I say all the time now is, regardless of what you make, I think we all at some point have to interact with the healthcare system and maybe have some sense of how difficult it is to get the things that we need. And while we fight to increase access to care, here we are just trying to hold the line sometimes. For what people already have, so it's fun to be here.
Thank you. Okay, so I'm going to start with you, Scott. Can you just kind of explain a little bit more about what Medicaid is and why it's important to Floridians?
Yeah, so Medicaid, which I'll just assume, if you're sitting here, you know what it is, right? And you know why it matters for the most part. But it's a health insurance program, just to be technical for a second. It's a health insurance program that we have for low-income Floridians. And we actually have one of the more restrictive programs in the country, but still manage to cover 4 million people, right? Over 4 million Floridians still, even with the restrictive limits that we have, still manage to qualify for this program. What it means for people, it's a safety net, right? So it's the thing that keeps a lot of folks from falling completely into bankruptcy, and we know medical debt's like a rising issue for a lot of folks. But Medicaid stands in the gap for people who don't have another way to get the care that they need. And when we think about who's enrolled in it, right, I think sometimes you talk to legislators, you talk to people on the street, and people have a very firm sense of who it is. But maybe what we miss is just how many of us, how many different people in our own communities, people who look like us, people who don't look like us, are impacted by it. People in rural communities, people in urban centers, Black, white, Hispanic, everybody. In one way or another, all of our communities rely on Medicaid in one way or another. And then, just quickly, since I'm in a church, I'm going to pontificate for a second. But it's not, for me, the point that it's not just the people who are enrolled in these programs who are impacted, right? I think each of us, every person is a universe. Pastor, you correct me if I'm wrong. But it feels like every person is a universe in and of themselves because of the ways we're all connected to each other. So one person loses coverage means everyone around them, everyone who comes in contact with them is impacted by that loss and the pressure and all the things that one person feels. So that's why it matters.
Thank you. Same question for you, Kim. Talk about SNAP and why it's important.
We all know what SNAP is, right? We all know what it stands for? No, good. I'm glad you don't. So we're going to talk about that. SNAP stands for Supplemental Nutrition Assistance Program, SNAP. But you all probably know the old name. The old name was food stamps. Okay, that's basically what it is, food stamps. And it's the ability to provide some food access for low-income families. Basically, that's what it is. It's a federal nutrition program that helps them buy food. You all know in the past it used to be actual food stamps, but in the 90s, they actually changed it where it actually became, the 90s is when it became a card. So now it actually almost looks like a credit card. Okay, did you know that? So it provides monthly benefits on a card, which can be used at grocery stores, farmers markets, retailers, mom and pop stores in the communities that we all live in. And to purchase whatever it is that they need to buy. And it's something that I think about all the time. And when I came here to talk to you all, I said, what am I going to say? Because I've been really emotional about this. So I said, Kim, breathe. So I'm breathing because SNAP is something that I've been affiliated with probably, let's say I will be 60 years old come September. So basically it's 51 years old, I believe. Okay, so almost my whole lifetime, I have been able to help people in my career to be able to know what SNAP is, what food stamps is. And for me to even think about that it's not possibly not that it's not going to exist, but exist in a different way, that it's not going to be available possibly in the same way, is very, very concerning to me. Because this program has really, really helped, as you said, be a safety net. It's that extra opportunity for families to be able to put food on their table and not have to make choices between paying for food or paying for their rent, paying for food or putting gas in their car, paying for food or having to get medicine. It's food. That's something that we all should be able to have, right? So many of our families that we work with, many of them here at church or many of them in the community, SNAP is just a way to help them to be able to just get a foot forward. It's a lot of times we hear so many negative things about it, but I'm here to tell you that people rely on this program. There's many people who you probably come into action with every day that are given this program. And so I know for a fact that the families that we work with in the community, you know, and I know we're going to talk about stories, but it's something that is very hurtful to them to even think about that it might not exist in the same way. And so SNAP is just something that has been there. So people say, well, what is SNAP? What is it? Just say it's a program that is there to help. Literally a safety net to help people to be able to thrive. I know I went on a little bit too far.
No, I love it. Thank you. With both SNAP and Medicaid, you know, even though they are an important safety net, Florida doesn't have the most expansive programs or the most effective benefits. So could you both speak a little bit about your efforts, our efforts, I guess, to, you know, make these programs better in recent years, and kind of what's the state of both of those programs when it comes to how we might compare to other states, or like, you know, efforts that we've all been a part of recently to improve these programs and make them more effective for Floridians?
Yeah, I could definitely speak to that. Really recently, one of the programs, which is it's a summer program, it's called Summer EBT. Is that okay when we talk? And this is a program, Summer EBT, which is a program that's dedicated to be able to allow families to receive about an extra $120 to be put on their EBT card so that they can purchase more food during the summer months. Because over the summer, children have access to another program, which is called the Summer Break Spot Program, or Summer Feeding Program, where we know that kids can eat for free. But this is a program that helps the household where there are other children. Okay, that's really important. So that's one of the efforts that Florida Impact has been a part of with FBI and other advocates across the state. And unfortunately, we have not been approved for that program. So that's a concern that we have moving forward. And there's about 11 states who have not approved that program. And so that is concerning. There are other programs that we had. Let's see, what's another one that we did? During the pandemic, we did the same thing. But the news with that is that's PEBT. That means pandemic EBT. At the last minute, our governor did decide to do that. So they did approve that program during those times. That was about, 4 years ago or 3 years ago? So now every year, we're trying to now do summer EBT, and unfortunately, that has not been something that we have been able to get approved. But advocates across the state, FBI, Florida Impact, and other organizations are working really hard to be able to figure out a way where we can get to our legislators to understand the importance of these programs.
You know, I'll take a step back to say that I'm just a big believer that society works best when everyone's an active participant in it. You know, when everyone's working, everyone's contributing in one way or another. And so when we say safety net, what I'm talking about is, or what lives in my mind, is just that backup for those who are more vulnerable in one way or another, are facing some disparity in one way or another, and can't fully participate at the level that maybe, you know, they have the potential to. And when you think about who Medicaid covers, working people, I think there's a perception sometimes that the people who do qualify for Medicaid are the folks who aren't working. But you know, 60% of the folks who are enrolled in Medicaid are working. It's people with disabilities. It's pregnant people, right? Seniors. Everyone who still has something to give, people who have a lot to give, who maybe just need that extra bit of help, who are working but not earning enough to get ahead, right? To build wealth and to do all the things. And so when we say safety net, I just put a point on that. That's what I'm envisioning. What's the state of our safety net? I'm literally imagining a net that has a bunch of tears in it that we've just retied, right? That's a bunch of knots that are barely holding together. When we think about Florida, in that it's successfully doing the thing. When we think about COVID, right? Like we just got through it, but how it was there for people when we had so many people who lost jobs all of a sudden, and our enrollment went up to, what was it, over 5 million. It was there for those folks, right? And now we've seen that number come back down, but that was the fundamental value of the program. But here we are, still fighting for, I'll say this, as we talk to people across the state, because part of our work as Florida Voices for Health is really connecting to people and hearing their stories and how they're experiencing these systems. And Medicaid is not a perfect program. It's got plenty of problems. There aren't providers in a lot of places. It's really hard to qualify if you're an adult. If you're an adult with no kids, good luck, right? There's so many parents who are working really hard doing the thing, and if they earn $1 more, they suddenly don't qualify for Medicaid. So this is to say, the Medicaid program in and of itself isn't perfect, and I think there's a lot of work to do to sharpen that. But certainly, what's not going to help is cutting funding. And I don't think that's the answer. So the state, it's one of those things where we have to hold the tension of both things being true. That it's a program that works and fundamentally helps people, works on some level and helps people, but also needs serious improvements. And to entertain cuts instead of having serious conversations about how to improve the program feels like the wrong way to go.
That's exactly kind of why I was asking the question, because there's been decades of advocates and community members and people trying to improve these programs and make them into a real safety net that doesn't have holes in it and tears. And so to kind of pull the rug under those efforts truly will just upset the whole thing. And, especially as we're facing, like I said earlier, the rising cost of living, and we have a housing crisis, we have efforts to not implement our state minimum wage, we have just a whole host of issues that people are facing, and to, instead of like during COVID, like you mentioned, expand the safety net, we're looking to like basically take it away.
What I did want to mention one thing, and I actually was reading something that Cindy had wrote. I believe she might have written it in like 2023 or 2024. And she talked about how SNAP is actually, we all know that it's actually a bipartisan program, right? We believe that everyone should support that, correct? And this is one program that has received bipartisan support forever. If I'm not mistaken, it's always had support for it. So fast forward, SNAP was actually 1939. Food stamps was basically implemented as a pilot, and here we are, 2025. And so, and we all know what was going on all those years. If you all are history buffs, we know how the war on poverty, which was there, and for us to even think that this program doesn't exist could possibly have effects on our families again, that maybe my parents or our grandparents might have suffered from, and here we are now in 2025. That's the part that kind of worries me.
So in the work that you both are doing, can you share a little bit about how are people feeling? Like most of us, a lot of people are really concerned and afraid, but give us a little bit of a sense of, as you're talking to people in your work, what are they telling you? How are they feeling at this moment?
Many of them are concerned and frustrated. I've been talking to, my husband works at the VA, so I have an opportunity sometimes to spend some time there, and I've been talking to some vets, and they're really concerned about how this is going to affect them and affect their benefits. I've been talking to senior parents, grandparents, who are now raising their grandchildren. And I have one particular woman that I've been doing some work with, and she basically she has her grandson who's now living with her from out of state, And her budget has basically been blown out of the water since she's been there. And her concern now is if SNAP does not exist the way that we know it, she's really concerned of how she's going to be able to feed him and feed herself and feed her other grandchild that lives with her. So basically everyone is concerned. They all know that it's going to affect them. I mean, think about it. You all, I went shopping yesterday to buy some regular things that we shop for, and am I mistaken that eggs are now $7.99?
Yes.
Is that correct?
Yes.
Can you imagine? So, and that's just eggs, and then you got milk, and then you got, so it's just going to be, the stories that I hear is overwhelming for me sometimes. It is because, and we've never experienced what we might experience. We haven't. So we're in the church, a great place to be inspired and hopeful, right? But we have to be prepared. And that's what this is about, to get the information out, to be aware of what can happen so that we can prepare and help our families, especially those who need it the most.
You know, the great privilege of our work at Voices is really getting to hear people share their stories and experiences. One that's come up a lot, but didn't really, I heard it in a new context today, but as we talk to people enrolled in Medicaid, there's always this talk of stigma, feeling stigma when they go to the doctor's office and things like that. And right, that just kind of lives in my mind as we talk to people about these programs. But it was earlier today, I was in Gainesville, gave a presentation, and afterwards spoke to a woman who was going through this idea of stigma, was kind of highlighting her experiences of, as she talked to providers, and tried to get the things that she needed, she had a very real sense that people treated her different because she was a Medicaid enrollee. What she shared, to answer your question, that I hadn't considered before, right? The stigma that she feels, that she gets from other people, connects to this idea that she's less valuable, right? She feels less valuable than other people. People make her feel less valuable than she should. And then she talked about how she's been hearing on the news, she sees on the news that Medicaid's going to be cut, this and that. And it only compounds that idea that she's less valuable. You know, that her and people enrolled in Medicaid don't matter. And that was something that that really just struck me on the drive over, you know? Thinking about that's what we're doing to people who already feel a certain way because they have this program, and every time they try to use it, people make them feel a certain way. But now the national conversation is these folks are such that we can just cut this program completely and cut them adrift, right? And cut this deadwood adrift. And that's a real thing that people are internalizing. And what she shared, the other thing she shared is she lives in this place, right, in an apartment complex or a neighborhood where there are a lot of folks in the same situation, and how the tension that builds internally for them just boils over to where everybody just hates each other, right? It's just now everyone's mad all the time and only taking it out on the people around them, and it just festers, you know? And that's what I think this creates. That's the environment that I think maybe this creates, and maybe what gets lost sometimes when we talk about people losing access to the benefits in a very real way. And that's a terrifying thing, but that it actually eats away at the fabric of community is a harder thing to reverse.
I also, I think often about, and I'll be transparent, it's okay, just for a minute, about 15 years ago, I had a situation where I actually was getting divorced, putting my twin daughters through college, and I had one daughter at home. And I was between contracts, right? So, and I'm telling the story because I want you to understand that SNAP is not for the people who sometimes we think it's for. It's for anybody and everybody who needs it. All right? At that time, it was a pretty dark place for me, and I believe I was going through that so that 15 years later, I can come here today and share my story with you. So at that time, I had some friends of mine who knew the work that I was doing. And here's Kim Johnson. I wasn't Kim Johnson at the time. And they're like, Kim, you need to apply for SNAP. Come on, that's what it's for you. trying to make ends meet. And I said, no, I'll be okay. You know, I was working 3 jobs trying to get it together, trying to get my girls through college. So I decided, you know what? I'm gonna go ahead and give it a try. So I applied. And yeah, it was shameful. I'm gonna be honest, it was. That stigma is real, okay? But I did it, and I was able to get it. And it's not and I don't want you to think that I only was able to get it for about 30 days. Or 60 days at the most, if I can remember. That's all it was, okay? But I tell you what, that was the first time during those 60 days where my situation was dark. I had a little light because I was able to look at my little baby girl who at that time was 4 years old. And I was able, when I knew at that time I had $20 in my pocket and $10 had to be for food and $10 I needed to put in my car, okay? But I had that card and I was able to get what I needed to get for those 60 days. And I think that's probably what resonates with me today, is that I remember it like it was yesterday. So for people not to be able to have to whip out that little card and be able to use it because they need it, to me is devastating. So I want you to remember that the people who are using this program, it is not regardless of color, it is not regardless of community, okay? Please know that. And I want you to share that with your friends and the people that you know, that this is a program that we need.
Thank you, Kim. Thank you. And thanks, Scott. I think, FPI, we are a fiscal policy organization, but we also recognize that it's not just about the fiscal impact, it's not just about the economy. There's also the ethical and moral right thing to do, and that's to help our neighbors and friends and family and ourselves also. And that there's every person is afforded dignity and respect and the opportunity to take care of themselves and their families, right? Regardless of who they are, right? We're running a little bit behind, so I want to move on to the Q&A. So if anybody has questions, or if you have a personal story to share, I encourage you to share it at this point. We'd love to hear from you.
My friend Barbara.
Hi there. This is more of a Medicaid question, but I was wondering, with those upcoming cuts coming, how do you see these cuts impacting the cost of healthcare, both to the health institutions and also the communities around them? Because I'm assuming at this point the government is absorbing a lot of these costs, but the loss of this coverage is probably going to hurt our county resources, our hospital resources. I feel like just put a general more strain on everybody's access to services.
Yeah, just to say, depending on who you are in the system, right? The cuts will impact you. If you're a county government, let's say you're from Miami. I'm from Miami, which is why I mentioned it. And people from Miami always let you know they're from Miami, so it's me doing that bit. They have Jackson Memorial Hospital there, right? Like a big community hospital. But basically, they rely on Medicaid the same way. Yeah, they serve a huge Medicaid population. If those folks start coming in uninsured, that's just more charity care. That's going to be paid by somebody, right? There's the federal rule in place, EMTALA, so no hospital really can turn anyone away. But someone's got to keep that cost, and that's going to be the taxpayer, one way or another, or the hospital finds a way to shift it to someone else. So if you're a hospital, you find a way to shift it. If you're a county government, you find a way to absorb it. Everyone is going to feel it in one way or another, I think is the easy way to put it. The simple way to put it.
Just to add to that, if you hear, anyone saying that, oh, we're just going to have the states pay for these programs, the state cannot afford to pay for these programs. And the state of Florida is projecting a deficit in the next couple years. So there's no way that Florida can shoulder that burden, and probably every other state, to be honest. So it's a bit of a not it, just have somebody else pay for it when they really can't. Sorry, go ahead.
Me?
Yeah.
Oh, okay.
There's a microphone behind you.
concerned because I work in the Medicaid field, not just, with health care, but I work in the long-term care sector. And I know I have a lot of my members come to me and they're worried because they're looking at, my ALF was assistance were being paid through Medicaid funding. What happens? Because a lot of them will not just not have health insurance, but they will be homeless. And you got people who are in a nursing home who, Medicaid will affect that. Once they do these cuts, would the state of Florida look at how we're going to apply these cuts and who will be affected first?
Well, I think that's the hard truth, right? Is that once and no one really knows what those cuts might look like, but once they're made, then it becomes a decision-making thing, right? Like, you have to either cut services or you have to cut eligibility. Like, who's eligible to receive what? How they actually roll that out, I think, is the open question. But you can bet that things like dental care, dental access will be the first things that they cut. I think, long-term care ends up being a big part of what gets spent in Medicaid, so it seems hard to not touch that in one way or another. But how do you make that decision? Do you raise the age limit for when some of those things are given out? Do you change income level eligibility? Those are the hard decisions that someone's going to have to make, and no one's thinking far enough ahead about who's going to have to make those decisions, which is why you can have talks about cuts now, but yeah, someone's going to have to figure that out.
And it goes back to what Kim said. We have not experienced this. We don't know how bad this is going to be. And it's really heartbreaking to think, what are those people going to do, right? Hopefully this won't happen, but we have to be prepared, right?
JJ's going to ask a spicy question.
My life is not waste, fraud, or abuse, and I do not want anyone to do to me. I am a 21-year-old college student, a disability activist, and I typed every word you hear today with my nose. Medicaid isn't some handout to me. It's the difference between living in my community or being trapped in a state-run nursing home. It's how I go to school. It's how I advocate. And it's how I live life. But now, because of these cuts, how much of the care that I need am I going to lose?
How can I answer that? Yeah. No, JJ, you're right. It's the difference between numbers on a page, right, and someone's story, someone's experience. Knowing that, right, it's real easy for some bean counter, I don't know if that's the word to just say, hey, let's cut this out of the budget and move on. But every single dollar of that, we know, and we already live in a situation where there aren't enough dollars in the system, right? There are not enough dollars to have caregivers at the level that we need for caregivers themselves to have what they need. We're already upside down. And so to take anything away, yeah. Guys, it doesn't make sense. I wish I had the words to explain or to try to make this make sense, but it just fundamentally doesn't make sense. So
What makes it hard is that it's wrapped up in this idea about, like you said, JJ, waste, fraud, and abuse. That sounds like a smart thing to say. We should be really efficient and blah, blah, blah. But the reality is that that's, the real impacts on real people are being misconstrued under this idea of being efficient.
There hasn't really been, you'll correct me if I'm wrong, but are there people who abuse the system? Sure. There is any system, right? But you look at the top, people who run businesses who, take advantage versus those at the bottom who maybe are enrolled in the program and shouldn't be. It's just to say, we want to have a conversation about ways to actually make sure that the people using the program are people who need it and should be using it. Let's have that discussion, but let's have a real discussion about it. Let's talk about how the fact that there really aren't that many people, especially at the bottom of it, abusing it.
Right.
Yeah. And what we do to clean that up.
Hi, my name is Barbara Harris. I live about 2 minutes from here, which is fantastic. There's one thing I want to say before I talk about something. I looked up today how much we were going to lose just in the 3 districts that surround this area of Polk County for Medicaid and SNAP. And the total comes out to $6.6 billion. Just in Polk County. That's how much we're going to lose in just 3 of the districts surrounding us. That floored me, absolutely floored me. I had come here to talk about something different, and then something happened in my life this week. My daughter ended up in the hospital. She's my only child, 45 years old. The mother of my 3 grandchildren. She was not feeling well at all, went to the hospital, and her liver numbers and her kidney numbers were off the charts. I mean, off the charts. If normal was 33 to 80, she was 259. She has Medicaid. She fought, I'm not going home. I'm not going home. We can't do anything, you know. I'm not going home. I'm not going home. I'm not going home. They finally kept her for 6 days. Let her go 2 days before her Medicaid canceled this month because she is no longer eligible because she did everything she was supposed to do. She went to a certain apartment complex that they built in Kissimmee for single mothers that about, I want to say 20 years ago, and she attended it. You couldn't have men there, you could only have mothers and children. You had to learn how to pay your bills, you had to learn how to take care of your kids. They taught you how to cook, how to sew, everything they taught them. She stayed in the program. She did so well in the program, she became a board of the directors of the program 2 years after she left. She then moved up to Dixie County, which is so rural, it takes her, I think, an hour and a half to get to the hospital, I believe. So she went in, and they sent her home, and I'm not quite sure where she's gonna go from here. She owns her own home now. She did what she was supposed to do to become a citizen of this country who supported her and her own and strived and thrived in that environment and used the benefits that came to her. She had SNAP for my grandbabies. She had Medicaid for my grandbabies. Heck, when I bore her, I had Medicaid. It was a generational thing. And then she changed the generational thing. She changed the generational poverty and did exactly what she was supposed to do. And now, who's going to care for her when she doesn't even know she's going to get through this? So now it's us that have to help if she can't, right? So now how do you put the rest of the family in the hole and call yourself lovers of children? I just can't. I just can't. Thank you. I'm sorry.
No, that's okay. And thank you for sharing your story. And you know, the one thing that I guess we go on next that we can talk about a little bit about what do we do now, right? What do we do? What can we do? And the only thing that I can say is that communities have to start banding together. We have to, places like this beautiful church here is a wonderful opportunity for the community to come today because we have to talk about these things. We have to have people come out, share their stories. We have to band together to figure out ways on how we take care of our children, our families, our seniors, our vets, our disabled individuals. What do? We have to start it by coming together and not be afraid to do that. That's the one thing that I would say. There's lots of things, of course, advocacy that we can do, but you know, as I was driving over here from Paca, I wanted to be able to say, we just have to just come together, regardless of what zip code we live in, because it's going to affect every zip code in this state.
So my name's Emily Shugart, and I think I want to just put a couple names on the policies that we're talking about, share that story. After my husband and I got married and had our first child, we were living on one student pastor's salary of about $28,000 a year. And when she was born, If it had not been for the health insurance that we received through Medicaid, I don't know how we would have afforded health care for our newborn daughter. And then the other name that I would like to give it is, my aunt's name was Laura Pinner. She died at 53 of ALS, Lou Gehrig's disease, and late-stage advanced Alzheimer's. And the amount, talking about a safety net of people and what is required to give that type of care, we relied on the Medicaid, and in doing so, she was able to pass with her family around her the way that she wanted to, and it gave her dignity. And so I lift up those names to share with you so that people can hear what they are and know that it's real, and that they're real lives that we're talking about.
Appreciate that. Yeah. Thank you for, Barbara. Yeah, thank you both for sharing that, because it's such a, it's a heavy thing, but it's a real thing, right? And I think the more we can do that, put names on it, and remind people just how real it is so fundamentally important. You know, I was saying this earlier this morning, that legislators, but it's not just legislators, the more I think about it, I think it's all of us, where all we have is our narrow experience, our very narrow view. Maybe if we're blessed to be experts in like one thing, we know that thing super well, but that's all, that's really all the space life allows us to have, is like knowledge about one or two, maybe two things. Soccer, and for me, soccer and like maybe a little basketball. Anyway, but legislators, right? Like maybe it's a farmer who now is a legislator, but he or she's tasked with making decisions about so many different things, right? Not just agriculture, but also healthcare, also education, and all the things. And there's some who are less open to it than others, but the ones who truly appreciate just how limited any one of our scopes are willing to have the conversation, or at least willing to hear these stories, and I think have their mind broadened that way, just to really fully understand from someone else who actually has had to live it or has had to work through these systems what it means. What it means to people. And I don't know, just to your point, that's the value. That's why we talk about sharing stories, right? That's why we talk about the experience of sharing that experience of having to use these programs and what it means to families. Because there are just some folks, I think if we go into it open, right? And open to the idea that this person will be open to hearing us, then there's an opportunity there to build a bridge through sharing that story and sharing that experience in a way that hopefully connects and makes a difference. And you never know where that difference is going to be made. Maybe you're just a seed. Maybe your story helps to water a seed that's already been planted. But I think that's the value.
There's a program that we also partnered on, SNAP Feeds Us, which was a campaign. It was actually a national campaign that talked about the benefits of SNAP in the community. And so Florida was one of 5 states that received the funding to be able to share that information in the community. And one of the things that was done first was there was a poll that was done around the state, and the information that came back, that came from our conservative residents, was that they wanted to hear the stories. They didn't want to just hear from organizations like mine, to say, yes, the program is great, we need it. They wanted to hear from the community where it was needed the most. So that's where you all come in at. If you do have stories to share, you can definitely, contact Florida Impact. We would love to talk to you. A few months back, we did come up with a document that actually had, just basically some information that the community shared with us. That's one of the things that we love to do. We love to get out to hear from the community, so that when it is time for us either to go to DC or if it's time for us to go to Tallahassee, we don't make up stories. These are not made up stories. They're real stories from real people. And I think, as you know, because of your organization, it matters.
If we could go to the next slide really quick, just on this topic of what can we do about this? There's a QR code that's going to pop up imminently. Oh, there it is. And if you point your camera at this QR code, and you'll get, everyone who registered will get this, all these materials sent to you afterward. It takes you to a page where you can actually tell your members of Congress to protect SNAP and Medicaid. This is so important. So please just take a moment and send that letter. It's very, very easy. And share it with your friends, share it with your family, share it with your neighbors, whoever might be interested. Because this is our moment to really make our voices heard and try to, prevent some of the worst harms that, we're facing right now. I'll also mention too that Florida Policy Institute has a coalition called the Safety Net Advocacy Coalition, which is over 100 organizations from around the state who are all working to preserve and protect and expand the safety net in Florida. And you can sign up to receive our newsletters. We do a lot of events and webinars and share out information and opportunities like this to take action. So again, that will be something you can reach out to Florida Policy Institute about. info@floridapolicy.org if you're interested. Also, you can wait till you receive all the materials as well. And the third thing I would say is, in regards to Medicaid, there is an effort that FPI and Florida Voices for Health are part of to expand the Medicaid program in Florida. I know we're facing some rough times ahead with Medicaid, but we're still forging ahead to make it better, to cover more people, to take advantage of an opportunity that exists in most other states that Florida has not participated in. So we're looking to the people of Florida to make this happen. So there are petitions outside to put it on the ballot, not outside, like in the lobby, to put it on the ballot in 2026. And we're really optimistic that when Floridians understand what's at stake and how this is going to benefit them, they typically do the right thing. So please take a moment and fill out a petition if you haven't already. And yes.
Is there a digital version of that petition that we could send out, something that people could sign online?
I'm going to turn that to Holly, or Scott, actually.
So there is actually a link that'll send you a copy. So you can't do it digitally, but it's really close that we can actually send you a pre-filled petition that you can sign, and it comes with a stamped envelope that you can send it right back. So
Okay.
we do have a link.
We'll include that in
we'll definitely share that in a state email. Yeah.
It's crazy because you can definitely buy a house signing electronic documents.
Yeah, right.
Yeah.
Right. Shocker, right? Yeah.
Did you have your hand up? Somebody over here? Okay.
So I just have a quick little question, especially about the SNAP. You said something in the summertime, there's areas that give the kids like food and free food and stuff. Is that like a designated area, or could like possibly we could?
Yes, absolutely. I mean, as I'm driving over here, I'm like, wait a minute, where is this church at? This would be a great summer break spot site. Yeah, so
Okay.
you absolutely could, because basically one of the qualifications that they don't want you to be so close to another site, and I'd have to look around to see if there's a school nearby or if there's another. We can talk about it, because basically it can be for any church, nonprofit, and you can basically have meals for free for kids that are 0 to 18. Good question.
Collaboration. I think with that we'll wrap up. Thank you everybody for being here. Thank you again to Pastor John and Emily for hosting us tonight. If I could just say one thing from me personally, I think, and I was thinking about this today, with everyone being so open and sharing your stories today, it's really touching and really important, and I hope you continue to tell your stories, everybody here, is that something kind of what you said about people feeling so frustrated and angry and kind of turning on each other, and like the breaking of that fabric of our communities is, I was thinking about just the importance importance of us remaining compassionate and kind to one another. One of FPI's core values is to be kind. So really, I think it's easy to be kind when things are going well, but when things are rough, I think that's a real personal challenge that I'm going to be focusing on, and I hope that we can all be kind to one another because we're in it all together. So thank you again for being here, and I hope to see you all at future events, and safe travels home.